All right, now we're going to get to the nursing part. What are we going to do? How are we going to assess nutritional status? First of all, we want to start with history. And one of the things we want to know is, how does that person typically eat? So we might ask them to keep a food diary. We might ask them to mark from a list of things how often they eat particular foods. But we want to know, how does that person typically eat? We want to know their food preferences. Do they have any allergies, intolerances, aversions? And we want to know about any medications, supplements, or conditions that can potentially affect nutrition. Okay. Then we want to do physical assessment. On the physical assessment, we're going to be focusing on signs of deficiency symptoms. We want to look at their muscle condition, how much subcutaneous fat they have, the condition of their skin, hair, and nails. Skin, hair, and nails can tell us a lot about nutrition. We want to look at their strength and coordination. We want to look at cardiovascular function, get some vital signs. And we want to look at how they're healing if they have any wounds. Anthropometric measurements are part of a nutrition assessment. Now we're going to look at weight, height, and BMI. There are some diagnostic tests that can be useful. We want to look at eyes and O's. We want to look at serum albumin because it indicates protein level. But serum albumin can be affected by non-nutritional changes. We also want to look at prealbumin because it's going to show more acute changes better. We want to look at risk factors for nutritional deficiency. We look at medical conditions. Do they have conditions that affect their ability to take in food, their ability to break down food, their ability to absorb nutrients, or their metabolism? Okay, so think about those 4 processes and what medical conditions might affect them. We want to assess, do they have any particular genetic predispositions toward nutritional issues? Some people have a genetic predisposition to weight gain or to be very thin. We want to look at age. Age affects nutrition because it affects all of those processes. It affects intake, but it also, as we age, all of those metabolic processes slow down. Mental illness can affect nutrition. How would mental illness affect nutrition? I want you to think about it for just a second. Sometimes patients who are depressed may eat as a comfort mechanism, or they may be unable to eat because they're depressed. Patients with anxiety may eat to calm their nerves, emotional eating, or they may not be able to eat because of the anxiety. Patients with other mental illnesses, patients with dementia, or patients with psychosis may actually not interpret their body's need for food. They may forget they've eaten, forget they haven't eaten. They may not interpret food items as food, or they may see non-food items and interpret those as food. So mental illness and mental disabilities, cognitive disabilities, can affect nutrition. Stress. People tend to have one of 2 reactions to stress in regards to food. Either they eat more to relieve stress, or they eat less because they can't eat because of stress. A negative self-concept can affect patients also in different ways nutritionally. It can affect our intake. It can, sometimes people with a negative self-concept may feel like they don't deserve to eat, or they may develop body image or issues, or even body dysmorphia. Sometimes also patients with self-concept problems may eat more as a self-calming mechanism. Poverty has a major impact, not just on the amount of food we can intake, but on the quality. Alcohol or drug abuse. People who have substance use disorders may use those substances in place of food, but also sometimes those substances affect our ability to absorb nutrients. Restrictive diets, and those can be for social reasons, for religious reasons, or for reasons related to body dysmorphia or eating disorders. But really restrictive diets are going to usually have a negative impact on getting adequate nutrition. And then food preferences. So we want to look at those things and see, do I see any risk here? Does this person have very restrictive eating? Is this person on a vegan diet, but they, if they're on a vegan diet, do they have the education? Do they have the knowledge base to choose foods with adequate nutrition from that diet? In the next section, we're going to do a BMI calculation.